The sleeve gastrectomy is a more recently developed operation for obesity. Like the gastric bypass, the affected stomach is made to be much smaller. In the gastric bypass, the excess stomach remains in place. It is just bypassed and theoretically could be used again. In the sleeve gastrectomy, the excess stomach tissue is removed. The word gastrectomy actually means removal of stomach. The sleeve gastrectomy is performed using small incisions called laparoscopic ports. The operation is similar to the gastric bypass and can be completed in 30 to 45 minutes. This video helps to illustrate the procedure.
The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes to help break down the food into a more simple form, so that it can be more easily digested and absorbed once in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments necessary for the sleeve gastrectomy.
The operation is thought to be effective because the smaller stomach is filled more quickly with less food, resulting in you feeling full earlier. Another reason for the effectiveness of the sleeve gastrectomy is that the patient has less of a hormone called ghrelin, sometimes called a hunger hormone. Ghrelin is largely made in the fundus of the stomach, and that part of the stomach is removed in the sleeve gastrectomy. The risks of laparoscopic sleeve gastrectomy are similar to those I described for laparoscopic gastric bypass. In general, the risk profile is slightly more favorable than the profile for the gastric bypass, but some recent studies have shown no difference. The usual hospital stay is about 2 nights, which is similar to the gastric bypass. Most patients are able to be back to work within 2 to 3 weeks.